Have you or any of your loved ones ever had a kidney stone? Well, I bet if you've had one, you are dying to know how to get rid of them and what causes them. Well, I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I'm going to be talking all about kidney stones. And if you want to join our community, I make content about sexual health, urologic health, bladder health, and much, much more. So make sure if you like what you see here, you subscribe and share this channel with your friends. So we're going to cover a few things during this video. We're going to talk about how kidney stones form, what kind of symptoms you might have when you have a kidney stone, what kidney stones actually look like, and lastly, how long does it take to pass a kidney stone? So let's get to it. Kidney stones are extremely common. About 1 in 11 United States adults will have a kidney stone at some point in their lifetime. That's a lot of people. And most commonly, people get them between the ages of 40 and 60. And so what causes them? Well, there are certainly a number of risk factors or things that are associated with people forming kidney stones. You can have some metabolic abnormalities. And what that means is it can change the way your kidneys process urine so that you may have a higher volume or lower volume of certain things that can either prevent or promote kidney stones. Also, you can change the acidity, either making it more acidic or more basic of the urine, which can change your risk for forming kidney stones. So there's no way for you to know if you have a metabolic abnormality without seeing a urologist or an endocrinologist and getting a 24-hour urine test and some blood work. So if you're concerned that you may have a problem because you keep forming kidney stones, make sure you get a full evaluation. But let's talk about some of the things that you might be able to change. First and foremost, and the easiest thing, is how much fluid you drink. So there are a number of studies that have shown that low urine volume, meaning not drinking enough fluids, which makes less urine, puts you at higher risk for getting kidney stones. So the American Urologic Association recommends that people who form stones drink 2.5 liters more of fluid, and that has been shown to decrease the incidence of kidney stones in people. Other things in your diet that might put you at higher risk for kidney stones are having a high salt diet. Interestingly, when you eat a lot of salt, it actually makes you excrete more calcium in your urine, which can put you at a higher risk for forming stones with calcium in them. Another thing that can change the acidity of your urine is having a high amount of animal protein. So animal protein creates a higher acid load, which then gets converted into your urine being more acidic or having a lower pH, which can put you at higher risk of stones. And lastly, having a high amount of oxalate in your urine, which is caused by eating things that have high levels of oxalate in them, like spinach, rhubarb, beets, nuts, those sorts of things can put you at a higher risk for getting certain types of kidney stones. And while I tell people there's a lot of things with oxalate in them, if you Google high oxalate foods, you can actually just see if you're having a lot of one of those things and try cutting that back first before trying to radically change your diet. Other things that are in your environment that can put you at higher risk are if you live in a very hot or dry climate, or you work somewhere where you're exposed to high levels of heat. This can cause higher levels of dehydration and can make it easier for you to form kidney stones. Obesity is another big risk factor. So being obese or having a body mass index of 30 or higher, which you can figure out by going online and putting in your weight and height onto a BMI calculator, can put you at risk because it changes the metabolic functions of your body so that you can actually have some of those metabolic changes more often in obese people than non-obese people. Other conditions, specifically hypertension, diabetes, and issues with your cholesterol, can also put you at higher risk because it can change the pH of your urine itself. Other medical problems that can put you at risk are if you have certain types of bowel disease, or if you've had kidney stones yourself before, or family history of kidney stones. And lastly, there's a number of medications that are known and associated with kidney stones, which you can see listed here. So if you've never had a kidney stone before, what are the symptoms that you might have? Well, interestingly, some people can have kidney stones that are sitting in their kidney that cause them no pain whatsoever. Typically, the pain happens when that kidney stone starts moving down into the ureter, or the tube that drains the kidney into the bladder. And it usually gets stuck in 3 major locations. One is called the uretero-pelvic junction, where the kidney connects to the ureter. The second time is where the ureter crosses over these vessels called the iliac vessels, where it can get stuck because it gets slightly narrow there. And lastly is at the uretero-vesical junction, or where the ureter meets the bladder, and that's where it can also get stuck. So typically, if it gets stuck or causes some blockage of the urine from the kidney because it's too big, that's when people will experience pain. And the pain can be in the flank or the upper side of the back, in the belly, or sometimes even in the groin. And that's because, particularly in men, when testicles are formed, they're formed inside the abdomen. And then as they grow in utero, when they're babies, they drop down into the scrotum. And so the nerve fibers for the testicles actually come from the upper part of the abdomen where the ureter is. And so sometimes people can feel pain in their testicle but actually have a kidney stone. Other symptoms that you might notice if you have a kidney stone is symptoms of a urinary tract infection. Particularly if urine gets blocked by the kidney stone, that may cause urine to not move like it normally does, which puts you at a higher risk for infection. So you might see blood in the urine, you might see risks of pain with urination, you might feel like you have to go more often or more urgently to urinate, particularly if that stone gets down close to the bladder. So what do kidney stones look like? Well, kidney stones can look different depending on what they're made up of, and they can be made up of many different types of compounds. Most commonly, we see calcium in kidney stones, but we can also see uric acid stones, cysteine stones, other different types of things that make up kidney stones. So you can see they can look very, very different depending on what kind of stone you have. So what if you don't have symptoms at all? Are you going to get them? Well, if you look at studies that have looked at people who don't have any symptoms, about 1/3 of people will get symptoms within that first 3 years. And of that 1/3 of people, maybe half of that smaller group will end up getting a procedure to get rid of their kidney stones. So it's a very small percentage of that original pie. And so if you're asymptomatic, it's very reasonable to continue to watch and observe them for a time, because they may not become a problem at all. However, sometimes while they won't cause you pain, they can put you at risk for recurrent urinary tract infections. So make sure that you do see a urologist if you start getting recurrent urinary tract infections, or talk to your primary doctor about getting some imaging to make sure you don't have any kidney stones. So if you're starting to feel symptoms of a stone, how long will it take to pass? Well, that depends on size. So that's where we get into size actually does matter. So depending on the size of the stone, it can take up to 40 days or 6 weeks to pass a kidney stone. But what they found is that in people who have stones 2 millimeters or less, the average time is about 8 days. But if you look at all people with 2 millimeter stones, it can take up to a month for those stones to pass. If they're between 2 and 4 millimeters, the average time is about 12 days. But if you look at all comers, it can take up to 40 days. And if they're larger than 4 millimeters or 4 to 6 millimeters, it can take on average 22 days to pass those stones, but for all comers can take up to 40 days as well. But interestingly, in that larger group, or above 4 to 6 millimeters, half of those people could not pass the stone. So if you have a large stone above 4 millimeters, about half of people will require a procedure to get those stones passed. And so very often it makes more sense to go ahead and get a procedure rather than suffer through the pain. If you're struggling with trying to pass a kidney stone, what can you do to help it pass? Well, the biggest and most important thing you can do is drink a lot of fluids. There's also some data to suggest that taking non-steroidal anti-inflammatory medications like Motrin or Aleve or ibuprofen or naproxen can help pass kidney stones because it causes smooth muscle relaxation of the ureter. Other medications that also do that are something called tamsulosin, which is typically used for people with an enlarged prostate. There's also some data to suggest that sexual intercourse can help pass stones and help with pain relief. And the reason being is that when you're having intercourse, your body releases nitric oxide, and that nitric oxide also acts as a smooth muscle relaxant. So if you're up to it, try having intercourse. It might help you pass those stones. All right, if you want to learn more specifics about kidney stones or other urologic conditions, please comment below. And as always, remember to take care of yourself because you're worth it.